Hello friends, I welcome you all to this discussion on ethical issues in health profession. As you know, the healthcare industry has graduated from a purely healthcare sector to a healthcare industry. As you know, when the term industry comes, a lot of legal implications are also coming in it. So it's very important for the healthcare professional to be aware of ethical complications of professional acts. Before discussing what we mean by ethics, I would like to enumerate something called as values. What is moral values? Moral values help a person to determine what is right and what is wrong. Same way, your professional ethics, or the term ethics itself, helps an individual to function efficiently in the society and in professional life. So ethics creates a clear-cut guidelines for an individual to act professionally in his professional life and act socially in his social life. So most of the times these principles of ethics a person gets from his religious background. Most of the times, this might not be true in many cases, but most of the times we get the first idea of ethics from our religious background. The term ethics comes from a Greek word called as ethikos and ethos. Ethikos means character and ethos means custom. So you are matching your character with the custom of the society. I would like to tell you a story. There was this shopkeeper. Okay, so to meet this shopkeeper, a really old fellow comes. This old fellow is coming and telling to the shopkeeper, "Sir, I want this medicine. It's very urgent. It's a drug for cancer. My relative is having cancer, and I am really in need of this drug." So you are the shopkeeper, and you are asking, "What's the cost?" So you are searching for the medicine, and you can find out that it's a really costly medicine. You are handing the medicine to that old man, and he's telling, "Oh, I'm sorry, I'm not having this much of amount. Can you give this thing for not for free, just now can you give me this medicine? I'll return in 3 minutes, or in an hour I'll return you the money." So this question puts you in a tricky situation, whether to give that medicine to the old man or not. So if you are giving that medicine to the old man, you are ethically correct, but professionally you are wrong. If you are not giving the medicine to the person, you are ethically correct. Sorry, if you are not giving the medicine, you are professionally correct, but you are ethically wrong. So there's a big conflict taking place between this professional and personal ethics, or might be your work ethics. So in any ethical situation, there are three important components. One is actor, second is conduct, and third is effect. In the above said scenario, who is the actor? The shopkeeper. You as a shopkeeper is the actor in that scenario. Second is the conduct. The conduct is basically your action. You can either give the medicine to the old man or not give. And then comes the effect. So what happens if you are not giving the medicine to that person? What will happen to the relative? So three important components are there: your conduct, your action. You can give either the medicine you can give to the person or deny the medicine to the person, and effect. If by your action, what's going to happen? That's the effect. So these three components mainly determine the effectiveness of your ethical judgment: conduct, action, and effect. Then I told that whatever action you do, it has got two dimensions. One is legal, other is ethical. Okay, so in this legal and ethical dimension, you can have four possibilities. Four important possibilities are there. What are these four possibilities? Whatever actions you are doing can be legally correct, ethically correct. So how can it be legally and ethically correct? Suppose we take the example of the shopkeeper. I am giving that amount from my own pocket. It's not affecting the functioning of my institution. So then my action is legally correct and ethically correct. If I am giving that medicine for free, then it might be ethically correct. Ethically in the sense, your personal ethics. But professional ethics might not be correct. So, it's a fine line. You cannot really judge what is right and what is wrong. It is purely subjective. But you should know this fine line of judgment in case of a professional litigation. When you are being dragged to the court, you should be aware of that. So whatever actions you do, it will have four dimensions: legally and ethically. Either your action can be legally correct and ethically correct, or it might be legally wrong, ethically wrong, or legally wrong, ethically correct, and legally correct and ethically wrong. It's a complex stuff, but you should be aware of this. So whatever actions you have, you should know about these things happening. I'll talk about the four ethical principles. There are really four ethical principles. They are beneficence, non-maleficence, justice, and autonomy. What do you mean by beneficence? Beneficence means a professional is taking a pledge that whatever action I am doing, that will be in the best interest of my patient. That is beneficence. Beneficence means you will use your assessment technique or your knowledge to determine the best possible treatment to the patient. That is beneficence. Act in the best interest of patient. Second one is non-maleficence. What do you mean by non-maleficence? It means to do no harm. By your action, you will never harm the patient. I'll tell you a scenario where a young physiotherapist meets this beautiful client, a lady, while treating. If he is developing emotional relationship with the client, that's the most unethical thing that can happen. The law of ethics says that the relationship between a patient and his healthcare professional should be purely therapeutic. And if you develop personal feelings towards it, the session should be terminated and patient should be referred to another healthcare professional. It's greatly a wrong thing to develop personal feelings towards your client. If you are developing personal feelings towards your client, your relationship changes from therapeutic to personal, then might be romantic, and it's a really wrong thing to happen. You should do no harm. No harm in the sense physically, socially, emotionally, spiritually. All these components are really essential. Next, coming to justice. Justice in the sense You should never discriminate the treatment based on race, creed, or your personal prejudice. It's a wrong thing to do. If you have a personal enmity towards a person, if the person is coming for treatment, he should be dealt in a professional therapeutic way. It's a wrong thing from your part that you are trying to bring your personal prejudice and rejecting treatment to that client. Next is autonomy. Autonomy, what does autonomy mean? Autonomy means that the patient has complete right to reject your treatment even if you are prescribing best possible treatment to the patient. At that time, you don't have any need to feel offended by the patient. He has the right to select another healthcare professional even if you are giving him the best treatment. So these are some points that you should remember. Always remember about the ethical principles. Remember about the legal and ethical implications. Then remember that your relationship with the client should be purely professional. And when you pass this information, if you can take some point of what I said to your professional life, then my information will become a transformation. If someone gets transformed by this information, then a role of a healthcare professional really gets fulfilled. So remember, as a professional, you should be discussing about all these things, because in the coming era these things are of great significance. Ethical laws will predominate, and you should not be sued in the court for following a non-ethical professional conduct. So always try to inspire, ignite, and innovate. And whenever we are looking, we can see that the firepower is really in our fingers. You really need to concentrate where the fire is, and sometimes you can just see that it's there at your fingertips. Only thing is you need to concentrate. So that's a goodbye from me. In the next session, we'll be discussing about how to deal with ethical dilemmas.